Hello, Green Spring. Today is Tuesday, October 13th, 2015, and I'm Fran Duval, your host for today, and I'm happy that our first guest is our medical director, Dr. Bethel, Dr. Sonia Bethel. Good morning, Dr. Bethel.
Good morning to you.
So, the medical center has something new and that you're going to tell us about today.
That's correct.
Get going.
Okay. Well, we're focusing on a new Medicare initiative, which is called Chronic Care Management. The initials are CCM. So if you've been to the medical center within the last 3 or 4 months, you'll notice that on the wall there is a plaque that really talks about that. And I'm just going to, spend a little time just sort of giving you some more information about it. So the Center for Medicare and Medicaid Services has determined that folks that are 80 and above who have more than one chronic condition, an example of that would be diabetes, congestive heart failure, chronic kidney disease, Parkinson's disease, atrial fibrillation, dementia, history of strokes, degenerative joint disease. All of those are chronic conditions that will require treatment by various disciplines, various modalities, various subspecialties, and the gatekeeper for all of those activities is your primary care physician. So if you are 80 or above and you have one or more of those conditions, you would qualify to be a part of this new program. What it involves on the resident's part would be having an appointment to discuss whether or not you think that this would work for you. It requires developing a care plan, which is sort of similar to an annual wellness visit, but it has a few more components to it. And then you sign an agreement that you want to be a part of it. And then it allows Medicare to reimburse the medical center for activities anything that happens that's not a face-to-face visit. So whether it's a doctor or a nurse practitioner talking with one of your specialists about one of your conditions, whether it involves talking to you about a lab result or an X-ray result, whether it involves scheduling an appointment with a different physician. All of those things qualify as chronic care management kind of activities. And 20 minutes or more that's accomplished in a month's time in a 30-day cycle would mean that activity would be active for you. So you will be hearing more about it. What we're planning is to have the medical assistant that checks you out when you're leaving the medical center, that she will have additional information for you, and then we'll be able to set you up for your appointment for the care plan, okay? Because that is an integral part of just getting all the activities coordinated. So Medicare decided that this was a good idea because obviously you can become frail because of age and having multiple conditions. So your functional status can diminish as a result of it. You can have more emergency room visits because of it. You can have a need sooner for moving to long-term care as opposed to being able to stay independent in your apartment. You can have more readmissions to the hospital once you've had an admission. So the goal is to coordinate care outside of the hospital to try and prevent that from happening. Okay. So it involves all of the entities that are here at Green Spring. So you're in a perfect place to make use of social work services, skilled nursing services over in the continuing care facility, physical and occupational therapy, mental health, podiatry, your physicians and nurse practitioners. So the whole care team, can be involved with your health. Okay.
Wow.
So how does that sound to you?
Well, I think the first thing that came to my mind when you began telling all of these different things was did it require new staff? And so you've answered that no, we would use the existing staff.
Right.
You might have to add somebody here or there. But it sounds sort of ideal that one would, if I understand it, one would have a team that each of those people knew the whole situation.
Right.
Rather than only the primary care doctor. It would sort of also give each of those team members a support. Never mind what it does for the
resident,
the patient.
Yeah, exactly. Well, you know, one of the advantages of being at a facility like Green Spring is that we have an electronic medical record, and that is one of the components that was a requirement from Medicare, so that all of the providers of care would have, you know, access to any activity that is ongoing. Another element is being able to communicate on more than one method. So phone communication as well as email communication via the health portal was another requirement. And then the third one was having 24-hour access. So having an on-call physician 24 hours a day was something that was already in place, you know, because of Erickson standards. And so that just meant that it was, you know, sort of a simple transition to think, yeah, that makes sense. It's going to be a benefit for our residents, and so we definitely want to participate. Now, there are some offices that are not primary care offices that are choosing to participate. However, we really feel that the primary care physician is, you know, is best positioned to, you know, to sort of manage, you know, all of the care for the resident.
You know, sometimes on television or on the paper we read of these issues where someone is having a face-to-face with a physician only on electronically, you know, on a computer screen, discussing whatever. Are we anywhere near that kind of
No, we're not.
We probably won't. Part of that might be the residents not being able to do it anyway.
Well, that's true, and in part, I think the fact that we have the availability of a face-to-face visit makes the need for that, you know, that sort of exterior kind of visit. No, I don't foresee that happening in the near future. Probably not ever. Yes, exactly right.
You know, a resident just said to me the other day, because I had reason to use the on-call physician at 11:30 at night one night, and they said, oh, I didn't know we had 24/7 care. You know, I said, oh, yes, there was a physician on call each night, each weekend. So maybe your comments today will enlighten more people that we do have that provision. You don't necessarily have to go to the emergency room.
Right. Now, often when you have contact with the physician, it may be that that person is going to recommend that the emergency room is the best choice.
Of course.
But not always. I mean, there's some times that you can talk through whether it's well, I miss taking my medication, or you know, I'm having, you know, some GI upset, stomach upset, or something. And there are times when, you know, you can get the assistance that you need just by a phone call. And then if not, then, you know, certainly one of us would say, well, this sounds more like, you know, you may be becoming dehydrated or whatever, and there are services that the emergency room can provide that you should, you know, avail yourself of. So
and our electronic access by, like the HealthPlex up here, on, you know, the fact that a resident here can walk in there and not even have to show ID. I mean, it's like they look at the picture on the screen, they look at you, and they, you know, it's amazing the comfort that gives, that they know your record, they see what medicines you're taking, what, you know, it's a really comforting thing.
Yeah, well, it's good to hear that, you know, from a resident standpoint, because as a physician, you also want to know that the care is being provided, and that, you know, the patients that you're taking care of feel that they, whatever setting that they find themselves, that there is a smooth transition.
There is,
so,
absolutely, up at this HealthPlex.
Right.
Now listen, I don't want you to get sidetracked with my questions. Do you have How's the flu vaccine thing going? Is that
Okay.
are we-
Yes, we're doing very well at last count, and I'm going to probably be lowballing this a bit, but I think we're probably somewhere around 1,300 to 1,400 flu shots that have been given. We started, of course, with flu clinics for the independent living residents, and then we have moved to Garden Ridge, and all of the units have had a session where flu shots were being provided from the medical center staff. So we're very happy about that.
Good.
And we're also continuing with the efforts to offer Prevnar, which is the updated pneumococcal vaccine
for pneumonia.
Yeah, and we, have been leading the way among the Erickson campuses for administration of the Prevnar as well. So we're, I think we're
Well, the fine laboratory staff over at the medical center are good with that. They remind or they ask.
Yes.
Have you had this? Have you, let me look here, and that sort of thing.
Yep.
So they're right on top of that.
That's helpful. And the electronic medical record makes all that happen. We will be transitioning to a new health record provider probably by late spring of next year. We've kind of maxed out the potential of our current provider.
Okay.
And so we are planning to make that transition pretty soon. So that will just make things even more, it'll be a simpler process of obtaining and retrieving information from the system.
Okay.
Yeah. Yep.
So we still have a minute or two. If you need to remind us of anything.
Okay. Well, I will just remind anyone who possibly has not had a flu shot that you may still just call and come into the medical center and get that. And if by chance you received a flu shot at an outside facility, just make sure that we get that into the record, okay?
Oh, that's a good point.
Even if by chance you've had a recent hospitalization and you had a flu shot during that hospitalization, that's something that we would ultimately know, but it's just good to have the records, updated as soon as possible. And so we just encourage you to, when you're in for a visit, you can ask your provider about chronic care management, or you could just go ahead and schedule your visit for that initial care plan, and just know that the efforts are there to just to keep you as healthy as possible and coordinate your care.
Well, that's great news, and I'm sure it's going to benefit all of us.
Absolutely. That's the intention.
Well, we'll look forward to updates on that as time goes on.
Great.
And the implementation and how it's working and how many residents and all of that, maybe the next time or 2 times from now.
Okay.
A visit. Thank you very much for
You're
coming.
welcome.